If you're a drug company looking for repeat custom, then antidepressants are a great product because people become reliant on a medication that never actually cures their condition. But even worse, I reckon that antidepressants are actually fueling the huge rise in mental health problems that we're currently seeing. Hi everyone, thanks for tuning in. I wanted to talk about depression because at work there is often a constant stream of people who have been on antidepressants for years, but they're still depressed. Same for anti-anxiety medication. Most people on them still seem anxious. So basically, doctors are not actually helping these people. We just seem to be dosing them up on drugs. Despite this, people do continue to take their medication, so they must feel it is helping them in some way, even though from my point of view, it seems to be giving pretty poor results. Sure, some people do go on these sort of medications for a few months during a difficult time, only to come quickly off and never need them again. But from my experience, this is a pretty rare scenario compared with long-term use with no clear endgame. There is currently an explosion in mental health problems in especially children and young adults. And if we want to get to the bottom of this, we really need to address the root causes. Some possible factors at play include previous childhood trauma, current traumatic life events, a lack of mental resilience, negative mindsets, plus our upbringing and learned coping habits, as well as the sort of people we surround ourselves with and how they influence our mindset. Whilst all these things may be contributing depending on your personal circumstances, I think what's really driving the huge rise in mental health problems are modern values and modern patterns of living, such as lack of community, lack of deep relationships, lack of deep purpose needed to underpin a meaningful direction in life, excessive concern for material possessions, image and status, constant financial stress, highly competitive work or school environments, and immersion in screens, tech, and cities rather than nature. These are just some examples of how the modern world creates such a depressogenic environment, and we can add to the list poor sleep and overly processed foods. Your diet and your gut microbiome have a massive effect on your mind via the gut-brain axis. Exactly how are antidepressants helping any of these? Well, of course they are not, but they often provide people just enough of a crutch to stop them addressing the key root causes. And that is how antidepressants fuel depression. Without antidepressants, society wouldn't just be able to carry on with business as usual, ignoring the root causes, as we are now. So if you have symptoms of depression, your body and brain may well be crying out to you that something is wrong. And rather than just try to numb that signal with drugs that attempt to manipulate brain chemicals, you should really listen to it. To start, try to get the following foundation. Firstly, reject the idea that depression is normal. It may be common, but it's not normal. Secondly, understand that you may need to take radical action, thinking well outside the box and going against modern societal trends. The rates of mental health problems are soaring. If you live like everyone else, then don't be surprised when you get the same result. Also, try to move outside in nature as much as possible every day, as this will help normalize your cortisol. Avoid overly processed food and excess alcohol, and prioritize sleep. And this is really important. You need to find one person with whom you can discuss addressing the root causes with. In other words, one deep and meaningful relationship with someone who you can be open with and who improves your mindset. Doing these things will give you a much better foundation from which to look at addressing the other root causes that may apply to you. Remember, drugs simply stop people addressing the root causes and so perpetuates the problem. If you found this video helpful, please do subscribe to my channel, as there'll be more to come on the root causes discussed and on building mental resilience. Also, check out my book, link in the description. Thanks for listening. I'll see you next time.